everybody, I'm Logan Crawford, and this is the award-winning TV show right here on Ebru Fresh Outlook. We begin today with a comprehensive look at the Ebola crisis, the outbreak across the globe, particularly in West Africa. We will look at its global ramifications here in the United States as well. There have been a handful of cases, and that has stirred up panic among some. The disease is possibly bearing political implications here in America, with midterm elections just weeks away. But in Africa, West Africa to be precise, this disease is truly a crisis. The suffering is truly palpable. Take a look.
From Ebola Ground Zero, Texas Governor Rick Perry has an update on Nurse Amber Vinson's contacts.
The 8 individuals that were in closest proximity to her, within 3 feet, are under active monitoring with 2 temperature checks a day.
Vinson is the second healthcare worker to contract Ebola. In Belton, Texas, residents are on edge.
They can say whatever they want to, that we don't have anything to worry about, but they're over there, we're over here, and I think it is something we're going to have to be worried about.
Schools in the Lone Star State closed over concerns that people with ties to them traveled with Vinson.
It defies common sense from my perspective that someone who has been in close proximity or have treated these patients, that they would go out and expose other people possibly to this, that they would travel out of state, that they would go on a cruise.
A Texas Health Presbyterian Hospital worker who did not have direct contact with Thomas Eric Duncan, but could have processed his bodily fluids, left Sunday on a cruise from Galveston, Texas. The health worker has been self-monitoring since October 6th, but has no symptoms. As the Ebola scare takes on a life of its own, President Barack Obama had appointed Ron Klain, former chief of staff to Vice Presidents Joe Biden and Al Gore, as an Ebola czar.
And welcome back. We are live again. Joining us is psychologist Janie Feldman, Bisi Ideradullah, who is the founder of Amani House, Mahmoud Ideradullah, who is the co-founder of Amani House, and we will refer to them as our Ebru News think tank today. And I'm going to start with you, Bisi. Tell us a little bit about Amani House. What exactly is it?
Well, Amani House is a nonprofit. We started in West Africa. My family immigrated to Liberia. Liberia's history is very unique. It's a location that African slaves went back to from the United States. And we thought we would live there happily ever after, but we got caught up in the middle of a war 5 years after moving there. And Amani was my daughter. It's named after my daughter, and we decided we would stick it out because so many children were suffering.
Let's flash forward to the present right now, and your husband Mahmoud is often on the ground in West Africa. Tell me about, we watched that package there, that news package, talking about the 2 people here in the United States who came down ill, the 1 person who died, 3 cases of it, and we are out of our minds. But in West Africa, it's much worse. Tell me what it looks like on the ground there. You've been there.
Yes, the numbers are much greater. Right now, as of October 8th, we have more than 7,000 cases of Ebola in not only Liberia, but in Guinea and Sierra Leone, with approximately, I think, 6,000 deaths, if I'm not correct.
That's about 4,000.
4,000 deaths. So it's out of control. Both governments of Sierra Leone and Liberia had said that they cannot turn that epidemic around without assistance.
I'm going to ask you, Bisi, quickly, what is your reaction when you see the reaction here in the United States to this crisis? For example, your husband, you said next week, is going to West Africa to work with people who have Ebola and in those communities. Are you afraid to let him go? And how would a travel ban affect him if it were to take place?
Well, a travel ban, the one that we're most worried about is the one coming back. He should be coming back mid-December. We have a clinic in Liberia. I just want to clarify that. And so he's managing the staff of the clinic. We've lost 2 staff already. We've had 2 deaths of our staff from carelessness on their own, not from a patient. And so I am very concerned about him. He has all the training that anyone could have in terms of how to take care of himself. But the least little mistake that's made can cause us our lives.
Janie, I'm going to turn it to you for just a second. We watch about this cruise ship. a lot of people say, hey, I'm not going to go on a cruise ship now. I'm not going to go to Africa now. I'm not going to get on a crowded plane now. We're modifying our behaviors based on a tiny, tiny fraction of the population here in the United States who have fallen ill. Why is this? What's your reaction to it?
I think the problem really stems from fear, and fear is coming from a couple of places. One, being able to trust that the information is reliable. And right now, according to discrepancies in the media, there is the supposed 21-day incubation, but there are questions and there seems to be differences as to people taking the proper precautions, and yet care workers are falling ill. The other factor is just in terms of the people themselves, and as you just mentioned, Bisi, in terms of carelessness. So we have education, we have policy, we have individual people doing what they're supposed to do, what they say they're doing. If you're quarantined, then stay quarantined. And so I think you lose trust and your fear grows when you see that there are holes in both the reliability of information and the trustworthiness of people.
Exactly. There's been a lot of misinformation. In fact, the president, days before we had our first case here in the United States, said the chances of having a case here in the United States were very low.
Yes.
That turned out to be wrong. You know, so that's the kind of thing that is building mistrust. We are joined by another guest in Washington, D.C. Her name is Katherine Marshall. She is with Georgetown University. And I am going to ask you, Katherine, for a quick analysis. Do you think that we have been failed by the international health organizations, such as the World Health Organization, in its response to this crisis?
Good morning, and delighted to be here. There's clearly a perfect storm that's taken place in the countries of West Africa and Liberia, Sierra Leone, and Guinea. A combination of a terrible disease that had never been there before and very weak health systems. And it took inordinately long for the international organizations as well as for the governments to respond. Now there's a massive mobilization that's taking place, but the potential consequences are enormous, not only for health, but also for the entire economies of the area, as well as for neighboring countries.
Okay, we're going to touch more on the economic impact, not only in Africa, but here in the United States. Bisi, let me ask you, now that the disease here in the United States, is there an upside to this, that actually the most powerful, richest country in the world is now invested in this disease?
I would say there's an upside only in that it can happen anywhere, that it's not a dirty disease that comes to Africans because they deserve it. But I think behavior here has shown that human behavior, no matter where it is suspect. We take chances, we take risks, and we should not. In terms of an upside, yes, because when it started in March and there were 5 cases in Liberia, the first thing I said to the people in my office is, this is a problem. If we're not going to get resources and mobilization to stop it now, it's going to spread. And now it is in the capital city, 2 million people in Monrovia, 400 beds for treatment. We are turning people away every day from hospitals. We cannot treat the people. We cannot test them.
And I was reading that some of the best and brightest minds from West Africa, unfortunately, have come here to the United States to practice medicine, and there is a dearth of doctors there. Mahmoud, somebody wrote on Facebook this week, and I found it intriguing, and he wrote that he thought it was people's disregard for black people in general, and in some cases hatred of black people, that has fueled the American reaction that we have seen in this country of absolute panic in some cases, and wanting to quarantine basically a continent. What's your reaction to that? Do you hear any truth in those statements?
Well, I think there is some truth based on historical analysis of situations that have happened in Africa previously. Usually Africa is considered like the dark continent, a misnomer, and often things go undealt with there, or overlooked until it becomes a crisis situation. Now, as this happened, this disease was actually historically has been there since 1976, when it first broke out in Congo. Now, up to that point, up to this present day, it had not had a large impact on Africa. As it happened, and because of the large outbreak that exists there now, it became a bigger problem, because the deaths and the incidents, it more than triple, I think, all the cases and deaths from previously. Now it's maybe four times the deaths previously. It was not a problem still until it was noted that there was still movement out of these areas of the epicenter, not only to America but to Europe. And of course, when it initially broke out, it's an African thing. It will not involve the United States. It will not reach to Europe. That was seems like just weeks ago.
And now it has.
And now it has.
And Janie, I'm going to put this to you for just a second, because I talked to Mahmoud a little bit about the attempts to isolate Africa by some here in the United States. Mm-hmm. And let's talk about the other perspective now. What about those people who are saying that, you know, America first, we need to protect our country? Is that a normal, rational response from people, that they tend to not think as globally as they should?
Well, I think our culture is a little bit me first these days, unfortunately, and in the face of some life-threatening danger, some of that can be justified. But I'd like to think that all of humanity has some compassion for all peoples around the world, and I'm hoping there's a way to help people everywhere, but also to keep ourselves safe. And so I think we're relying on the authorities at the state and federal and local levels to understand the disease and to contain that virus so that everybody can be safe and that cures can be found and handed out. I understand there are vaccines and cures that are in the works, so I'm hoping that that great work that's happening can be shared with the whole world, and I understand it's in the test process right now.
Okay, let's turn to Katherine Marshall, who is in Washington, D.C. Katherine, whenever I hear a news report about the situation with Ebola here in the United States or in Africa and elsewhere, I'm confused. I follow the news very, very closely. I'm not sure if I'm at risk shaking hands with somebody who has been exposed, sitting next to somebody who has been exposed. We're told that the contact has to be direct and involve bodily fluids, yet these people aren't allowed to ride buses. It's confusion. What's the problem? Why isn't a clear message getting out?
That's a tough question to answer, because people have been saying very clearly what the situation is, that the risk is really very much restricted to bodily fluids. You have diagrams that show how much more contagious the flu is, how much more contagious other diseases are. But clearly the messages are not clear enough, and people are sufficiently terrified of a terrifying disease that they are not hearing what they're being told, or as my colleague was saying earlier, are simply not believing it.
Okay, let's turn now to get just a final word on Ebola. We're going to come back in a little bit and talk more about the economic impact, but I'm going to talk to you first, Bisi. Tell me, you know, you work with people directly in Western Africa. What would you like our viewers to know about this disease?
I would like them to know that people in West Africa are like people here. They're striving. They want their children to be educated. They want health care. They want jobs. They want professions. They have the same desires. Africa is not jungles, as people still believe. We are very geographically cut off in the United States. They're just African people, and they want the same things we want. They have this disease the same way it got here. It got into two very educated women. They weren't dirty. They weren't uneducated. They weren't the bottom of the barrel. And these are human beings. We lost 2 staff. Those are human beings.
And we learned during HIV that, you know, that you do not blame a person for his or her disease. Let me talk to you, Mahmoud, a little bit. You're heading there next week. Are you scared?
I would say so. Yeah. Apprehensive, high anxiety, because even in the time that I've left, the death has increased, the incidence has increased, and there still seem to be a little coordinated effort from the world community to try to help and assist the African governments to turn this disease around.
Okay, I'm going to stop you there. We're going to join you again on this topic in just a few minutes when we come back. More on the Ebola outbreak and its economic implications as well after this.